Hello, and thank you for dropping in on the site. Hopefully this video will give you some insight. This is the 2014 book. The 2015 book will be out relatively shortly. But let's just hit some of the highlights. These books are full of information, and that's a good thing and a bad thing. Good part is pretty much everything you need to know about the general Medicare world is inside these booklets. The bad part is it's not tailored to you. Everyone's situation is a little bit different. That's the reason you do need someone to tailor a program that's specific to you. Let's hit some of the highlights, and I'm going to try to keep from using acronyms. But one thing I do want to tell you about, when you see this right down here, the Center of Medicare and Medicaid Services, you will hear me refer to it as CMS as well. On page 16, it breaks down to how Medicare works and your choices. You have to have Part A and Part B set up before you can take advantage of these options. They all have to work together. You don't lose Part A and B once you're signed up for them, but the way it's broken down for illustration purposes. Part A and Part B is the first thing you get when you get signed up for Medicare. Part A takes care of hospitalization. We'll get more in depth later, and also more in depth on Part B, which takes care of your medical services like your doctors and specialists and outpatient surgeries. In addition to Part A and B, it does not cover prescription drugs. You have to take up an additional prescription drug program if you want prescription drugs covered. In addition to that, everyone knows there's 20% left over off of your billings from Part A and B. It can be covered in this case scenario, under a supplement program. It will take care of the 20% that's left over depending on what plan you decide to go with. The right-hand side is talking about Medicare Advantage programs. Although you do not see Part A and Part B on this side, your carrier is being monitored and taken care of by the federal government, CMS. Let me stop and say this. Anyone that's been in the hospital knows that you can rack up an $80,000 bill pretty darn quick. Some a whole lot higher. But let's say you rack up an $80,000 bill. If you only have Part A and Part B, what's going to happen is that you're going to have 20% of that bill left over, so you have $16,000 that you're going to be left over to pay. In addition to that, when you come out of the hospital, any prescription drugs assigned to you, you have to pay out of pocket as well. If you only have Part A and B. On the right-hand side, all your care is monitored but not administered by Medicare. It's administered through private insurance carriers. Now, for you guys that are turning 65, leaving your employer's work program, on the right-hand side is going to work very similar to what you're already used to at work. Private insurance carriers, most likely the same insurance carrier that you had at work, is going to offer you a Medicare Advantage program so they can maintain taking care of you after you leave work. Most Medicare Advantage programs have Part D's programs inside of them. So on the left-hand side, you have multiple cards, multiple people taking care of your needs. On the right-hand side, you have one private insurance carrier that's pretty much taking care of everything. Now, I said this is going to be a short video. There's other videos on this website that's more in depth in the individual areas. Please, if you have not reviewed them, go back to them. Once again, this is a review of the booklet and information that's inside of it. Page 19. The main thing I want to go over with this is that if you're qualified over 65, drawing your Social Security or retirement checks or benefits, you're going to probably get signed up for Part A and B automatically. It's going to show up 3 months prior to your 65th birthday or your Part A and B start dates. Part B is not always the same date as Part A. But under Part B, if you have qualified coverage through an employer or some other means, if it's qualified through the federal government, you do not have to take up Part B until after that ends. Okay? Qualifying for Part A and B are very similar. You need to work 40 quarters as a full permanent resident of the United States or a citizen. That is 10 years worth of work with premiums being taken out for Social Security and and Medicare and everything else. When that takes place and you qualify, when you start Part A, if you see, it does not require a monthly premium. They say it's free, but what that really, the reason that's in there is, guys, if you sign up late for Part A for some reason, the bill is actually, the part of the bill that you don't see is $426 as of 2014. It goes up and changes every year. If you're late, that's what your penalties are going to be based on, right here at the bottom of this page. Penalties for Part A can be 10%. So let's say that you wait 2 years. Let's use the illustrations here. What's going to happen in that situation is that 10%, which is about $43, is going to be charged, and it's going to be charged for twice the length of time that you do not take up the coverage. So if you're not covered for 2 years, you're going to pay that 10% penalty for 4 years. If you didn't take it up for 4 years, then it's going to be 8 years that you're going to pay that 10% penalty. That's Part A. Part B, next, works a little bit differently. The premiums for Part B is typically $104.90. I'm going to say $105 from here on out just to keep it simple. But $105 in 2014, it does change every year. But if you're going into it this year, it's going to be right at that. What most people will not tell you, if you are not aware of, it is based on income. You probably know that. But if you're over $85,000 as an individual, $170,000 filing jointly as a married couple, it's not going to be $105. It's going to be higher based on whatever tier level you go into. Okay. Once again, if you have credible coverage, you don't have to worry about penalties. But if you do not have credible coverage and you enroll late, there is a 10% penalty fee. Okay. This is a little bit different than the penalty fee that's Part A because it's 10%. It can go to 20% for every 12 months that you're not on the program that you should be. They're going to add another 10% penalty charge to that. So it can go from 10 to 20 to 30 of that $105 that we saw prior. So you have to be aware of that. Sign up for these programs when they are available to you. If you do not have credible coverage, it's the safest bet. Also, what does Medicare cover? Guys, it covers a lot. Inpatient, outpatients, doctors, physicians, all that kind of things. There's some things that it does not cover, but one thing I do want you to be aware of, that the entire industry is shifting. Insurance carriers, doctors, and everyone alike knows and agrees that it's less expensive to take care of a patient ahead of a problem taking place than afterwards. What do I mean by that? Preventive care. Go in for your services, your different checks, your different mammograms, your different dye tests, everything that they ask you to do, go get it done. The reason for that is it's called preventive services. They do not charge you for it. Let's relate this to a car. You're driving down the road, you hear this little tick, 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 this little noise that's under the hood, and eventually you hear it for so long you get used to it. Well, someone else gets in the car with you and they say, man, don't you hear that ticking? Don't you need to get that checked out? It sounds pretty bad. Same thing when it comes to preventive care. As we get older, we get these aches and pains that we get accustomed to, but it doesn't mean it's normal. We want you to go get that stuff checked out, because if we can prevent a heart attack, if we can prevent a stroke, insurance carriers and everyone alike has agreed that it's much better to pay for those fees up front to prevent it than to wait for it to happen and then try to have to worry about ambulance services, medevacing you out, and heart attacks, intensive care surgery, stroke, rehabs, and all that kind of stuff. Long-term care is not covered under Part A and Part B. It is a separate program that you need to take out, but a lot of your long-term care programs will prevent you from going into a nursing home type of situation. They can be set up to keep all that in your own private home. You also have routine dental, dentures, cosmetic surgery, acupuncture, hearing exams, and once again, I put in here, prescription drugs are not covered under Part A and Part B as standard. Okay, they're governed by Medicare and CMS, but they are not standard coverages as far as the program. This is a brief slide under supplements. CMS has standardized a lot of things, but I wanted to show you this chart because under supplement, these are called plans. Plan A, B, C, and the rest of them. These are called plans, not parts. Parts are referring to your Part A, hospital, Part B, outpatient, doctor care, Part D, drugs, or PDP plans, and then Part C, also Medicare Advantage programs. Those are called parts. Plans are referring to supplements, so don't let those confuse you. This needs to be individualized. There's different moving parts here. If you see here, Plan F covers everything. That means it covers the majority of all the 20% that's left, but not prescription drugs, as we saw in the very first slide. Medicare Advantage plans, Part C. Once again, CMS regulated. They have HMOs and PPOs. HMOs got a bad name in the 80s because people were signing up for HMOs, and then the network only had 10 or 15 doctors in that local area. They're a lot better now. In fact, in the metropolitan areas, there's sometimes thousands of doctors that's on the program, and most likely the physicians that you already are seeing are under some type of Medicare HMO type plan. PPO plans, I know you're familiar with them. It's open access. You can go outside the network to use those services. It costs more money to manage, so they usually have a fee, a monthly premium that's attached to those, where HMOs, typically there's no premiums in addition to what Medicare is already charging. Got to be careful with Part D plans in just in this area. Remember, they do charge you a penalty if you don't have one, but if you go with a Medicare Advantage plan, most Medicare Advantage plans that has the HMO, PPO nomenclature, they also have prescription drugs included in there. That's the reason I said in the very first page, one card, one company takes care of all your needs instead of separating it out. Most insurance personnel would not tell you if they don't ask the right question or they don't know, is that regardless of what the plan you choose, even if it's a zero premium plan, if you make more than what's allowed under $85,000 as an individual, $170,000 as a joint filing jointly as a married couple, whatever your bracket is, CMS is going to ask for an additional amount. So let's say you pick a plan, maybe a Medicare Advantage plan that has zero premiums, and it has a prescription drug card applied to that. Well, regardless of what that plan says, if your income bracket is higher, you're going to get an additional fee. And that's what you have to be aware of. Your insurance agent may not say anything about it, but he cannot do anything about it, or they cannot do anything about it, nor can the insurance carrier do anything about it. That is something that's regulated. It's going to catch up with you eventually, just like the penalties will as well. Late enrollment penalties for Part D or prescription drug plans is different than the other ones because it's permanent. Once you actually miss your PDP date and you sign up for it later and you did not have credible coverage, as in TRICARE or one of these other services here, or maybe an employer plan, if you do wait past that window, you will get penalized. It's not a lot, but it's 1% every month that you're not on the program. 1% of the national average. This is very important. The national average in 2014 is $32.42. So if you get a plan that's zero premium and you waited 43 months, your penalty is still $13.90 based on that 32, and it changes every year, not on what you're actually paying. If you pick out a plan that's $100 a month for prescription drugs, $113.90. Okay, hopefully that makes sense. I keep saying it to drive it home because it's a waste of money. Although it's your option, I've seen it time and time again where a person take on a penalty thinking they never use it because they've never been ill before, and then when they need it, they either don't have the coverage, or when they take it up, they get frustrated because they're paying more than what is stated on paper because of these penalties that's on here. If you don't earn enough, there's different levels of Medicaid that the government in the states will pay your Part B premium, Part A premiums, your deductibles, your co-insurance, your co-payments. They will even subsidize your prescription drugs that's not quite listed here. And what that's going to do for you is lower your cost of prescription drugs to $1, $0, $2.60, much less expensive than what it would normally be. But these programs are out here. Now, I work mostly in the DFW area, Dallas-Fort Worth. Remember, on the right-hand side of the screen, there's a place where you can put in questions, and I'll get back with you as quickly as I possibly can. I'd like for you to send them in that way because sometimes I work 1 o'clock in the morning, and I can respond back to questions, and then you can just pick them up the next day. If you do need to call me, please do. I have only a limited amount of time to return calls, and I will only call during operating hours. Hopefully you enjoyed this video. I know I rambled and talked very quickly. Once again, there's more in-depth videos throughout the website. I hope you take advantage of those. God bless. You have a great day.